Hello, welcome back to Injury Mechanics. Again,
Hey.
we're back in the Bolton Clinic and with myself, Maria and Gus. And we're talking today about what's hot and what's not in the sporting and non-sporting world.
In clinic.
Clinic, and what we see on a day-to-day and a weekly basis. So top three, go on Gus, what's the top three things you see at the minute in terms of sports or non-sporting activities?
I think it's a classic ones really, is it? For me personally, if you talk about sport, it's sort of running, football, and then sort of your kind of racket type of sports. There could be various ones that prove in terms of sporting wise. Yeah, in terms of non-sporting wise, you're getting sort of classically, you're getting lower back pain, maybe some loading issue. It could be sort of, again, we've talked about tenders in the past, so that'd be one. That's fine, I can get you.
Go on, Maz.
I'm going to be sneaky and my number one's going to be cover two. So I'm going to talk about like events that I'm seeing a lot of, like a day, is hyrox athletes and runners, half to full marathon runners. I would say my second hot population or topic is pregnant, postpartum, perimenopause, menopausal women, so sort of the women's health, and also more younger population, so you're sort of school age, teenagers, sporting. I'm going to say specific conditions. Obviously, you get your usual sort of your knee, your shin conditions, but more spinal, like pars defect and stress fractures in the younger population. I've seen more of that recently.
I'm seeing, again, much the same as you. At first, generally with the running, the sparking running thing, I just thought it was because it's what I do. So I thought a lot of people was coming to me because I run myself. Ultimately, it isn't that at all. It is clearly just a huge spark in people uptaking running, which is brilliant, you know, people being active and getting out there. So I've seen a lot of running at the moment. Again, huge spark in hyrox over the last 2 or 3 years. It almost developed out of nothing. It came out thinner and everyone's doing it, which again, fantastic. People are into those type of sports. You've got variations of that. You've got things like Dead the Dozen, you've got people doing CrossFit, you've got all sorts of other variations of it, but it's much the same in terms of
And now the hybrid games is taking over. It's coming from the US apparently.
Oh, right,
so I hear on the grapevine.
Is that a new one? So is that a US accent as well?
Yeah.
So yeah, we've got those type of things. In terms of clinically, what I'm seeing a lot of at the minute, again, we touched on it in the previous videos, seeing a lot of tendinopathies at the moment, maybe because of this influx in people uptaking running and hyrox and these type of things. One sport that has come to a head a little bit over recent, probably 12, 18 months, is walking football, which we were chatting about earlier on. And it's just showcasing that there is options out there for a slightly older population. Do you know what I mean? It's not a case of we only treat athletes and we only treat people who are serious about sport or anything like that. We really don't. We treat people from all walks of life and they have their own qualms. I had a lady the other week with sore arm because she crochets a lot.
Actually, the high rocks, those kind of sort of more high intensity sort of weight / cardiovascular, that's obviously a big one. I think that kind of stuck in my mind a little bit because I was thinking I've seen, because of CrossFit prior to that, so I think I've kind of normalised myself and seen a lot of those type of activities. And yeah, like you said, walking football, you know, it's becoming more and more popular, isn't it?
But when you were saying the older population, I'm like, I feel like I'm creeping towards that. Because it's like, obviously, you generally say it's your older population, probably from like 50-ish, and it's just more like guys, I say guys because I don't know of females doing walking football, who are wanting to still be in that team environment because of all obviously the benefits of that socially as well, but to keep moving and because they enjoy football. But yeah, I think it's great, and it's like more like community driven as well, which I think it's just keeping you active and healthy.
Yeah, I think and again, I think we're going to continue to touch on it in all these different topics. I think there is a huge drive, social media-wise, in terms of the popularity of sports in general, because you're seeing people doing certain times, a certain race, a certain event, go, oh, I want to bash at that. And again, we'll never ever discourage anybody from being active, because that's what we're here for. You know, we're here to get people active, and whether that's, like you touched on before, hiking, going for a walk, getting active, take a dog for a walk, you know, just doing anything that will get them active. But I think people just have to be cautious with the intensity that they go at it, because it's so readily available on Instagram or Facebook, whatever it might be. You see so many people doing it. You might have already trained in the morning. You might have already done something in the morning, but because they've seen all these people go out and do something, or there's a few people meeting up for a social 5k or a training session at the track or whatever it might be, they get coaxed into it, they get sort of drawn into it. And it can quite quickly sort of spiral out of control into overtraining. So although, yes, it's fantastic that we're seemingly in a really healthy population at the minute, or the UK especially, we seem to be getting more and more active.
We are, but I'm going to butt in there. It's still a pandemic of obese and morbidly obese. Obviously, within a clinical environment, we're generally seeing you more active people, but we obviously see you non-active for various reasons, because they can't, because of the size, because of the health, because of pains, hence why they're coming to us, because they're in a bit of a vicious cycle. They can't reduce weight because they can't move.
Yeah, and you get that with knee replacements are a prime example. Surgeons won't do it if they're of a certain weight in terms of BMI or
and that threshold's coming less and less now because wait lists are so bad.
And to be fair with that, it puts me in a good mindset for post-surgery, because if they're already in the effort of whether it's losing weight or getting stronger, whatever it might be, post-surgery, they'll come out of it in a much better state than previous. So I do agree with it. It is necessary. There's no point in doing a surgery that's then going to fail when you come out of it.
And also, you're anaesthetic risk, aren't you? Because, it's all about those factors of, if you're in these categories of weight, we have to sort of summarise, you're more of a risk factor to us as an institute, as a hospital, to operate on you.
Yeah, I think when we talk about bringing it back to those hot topics, I think like you say, we're just kind of interested to see what the little trends we noticed. I mean, I heard about hyrox, maybe a bit longer than that, maybe 3 or 4 years ago with someone doing it, and that was probably, and it was about 18 months after that it really took off, and it's quite interesting. Sometimes we get to see trends. It's a bit like discovering a band before they become famous. Like, sometimes we're like that. It's interesting seeing how they go about and what, like you say, what people do to get there. And like you said, that's why it kind of slipped my mind, because CrossFit prior, which is still quite popular, but those are sort of like almost bread and butter for us to deal with. Like, and we do sometimes, our bias can get a little bit skew-whiffed. But I do think there's more people training though, because just anecdotally, if you look over 20 years, pubs are shut, gyms have opened. So there's a definitely desire to get more active within a certain part of the population, but then there's other sort of population where you've got like sort of an increase within those, and also prolonged. We've got an aging population as well, so that the balance of sort of higher up at the top is more older people than there is younger people, which then leads to stuff like you say, total knee replacements, your walking football, your crochet injuries. I've actually had quite a few knitting injuries in the last
year.
Yeah.
That's sharp, the needles.
I know.
Your reputation's getting around in the knitting community.
I know. It's like you say.
I can picture you doing a little knitting.
Talking about when you were saying about like say pub shutting and things, I'd heard something recently and I was like, that's really good, but I'm thinking, is there other reasons for it? The younger population, something like say 18 to 25 is at an all-time low in terms of an all-time high in terms of who's sober, just because they're choosing not to drink, which is really good, really positive habits. And I wonder, is that replaced with something else? Maybe, obviously, vaping, which is a completely another topic that we could do a whole podcast on, but it's obviously got some sort of positive influence. Maybe it is, the social media sort of healthy fitness. Is that in turn having an effect on the younger population?
Is it causation or correlation, that type of thing? Is it the fact that the two are just happening anyway, or is one directly impacting the other? You do see that though, obviously, when we get people in clinic, whether they're young adults or whatever, and you're chatting to them, there doesn't seem to be that, I don't know you two, obviously that want to go out at the weekend. Do you know what I mean? That what you're doing Saturday night, it was a rhetorical question when I was younger. You were going out, end off, but a lot of them are, I'm doing park run Saturday and I'm meeting my friends for a bite to eat and we'll go for a long run Sunday morning. I've got a gym session Sunday morning, which is obviously in terms of health fantastic compared to what we used to do. But is that the direct link? Is it a case of they're not going out because they're exercising more, or is it just pubs are shutting because beer's too expensive, rent's too much to run, gas and electric's too expensive? Is it?
But
Are the two directly linked?
You can always go to your friend's house and be drinking, can't you?
Yeah, I suppose so. Yeah, of course. I do think there is a shift, in terms of mentality. I think younger people are much more into the gym now. I was in the gym the other day. I just go to like a local leisure centre, and there was kids in there. At that age, I'd have never thought of going to a gym. I was swimming a lot, I was training a lot, but I'd never even considered going into a gym. But it was the most normal thing in the world to them.
Yeah.
Well, I started going to gym when I was 16. Yeah. So prior to that, I'd done a lot of sort of cycling, football, bit of a cricket, tennis, all these, bit of rugby league, a bit of a jack of. I kind of did a lot of that. And then one of my friends was into it, and so we used to go. So it was 6-1, so we used to walk down. You know, and again at that time, we were unusual. Like I always remember like just us being the young ones and everyone else being.
Everyone else was.
You know, like it was a bit of a like an old bit of sawdust gym. So, but it was that was kind of interesting. And then, like you said, now being my age, going to my gym and like seeing, you know, like occasionally I might just go mid-afternoon, sort of between clinics, and yeah, like the amount of, you know, I don't know, 14, 15-year-olds, I don't know, but sort of that kind of age group going. So there is, and again that provide, you know, why do trends matter? Well, we have to be on, you know, why are we asking that question? What's hot? Like, well, 10 years ago we weren't treating hyrox athletes or participants, whatever. You know, like weren't treating as many potentially adolescents in gyms. So we have to. So it's good to know like what's hot and not, what people think as well. Like, you know, not just anyone listening to this, but what they're thinking or what their kind of experience like, if they're similar to ours or different.
And kind of touching on that, and that again going back to that younger population, I think it's important to see that like the healthy habits. So it might be that you've just always been around exercise, or your background or your family, you've always done something like you've gone on walks or whatever, which is really positive. Some people just aren't exposed to those environments for a number of reasons. So it might not be their norm. Like to us, we're lucky in that sense. It's always been that to us. I was never like, you know, I really enjoyed sports at school. I might not always have been picked first, I might have been picked last, but I enjoyed it. I was a cheerleader once. That's my claim to fame. But the healthy eating, our family, we've always done healthy eating. So to me, it's the norm and I understand it and I really think it, you know, promotes health from inside out. But your populations, it's like you're getting into like your teenage years, your lads are like, they're getting a bit more like body conscious, so they're wanting to go to the gym, they might want to look aesthetically more pleasing, they want to get that confidence. So you've kind of got that aspect of it, which is great, but also they can, I know I've seen it in clinic, and they come in and they're training every day, they might be training twice a day, and it's like you're touching on your overtraining, but are they refueling the body right as well? But also then you might have your females that are a bit more, they're either following these like your booty programs because Joe Blogs on Instagram's got like all these women in doing these booty programs and that must be what I need to do, and then they're not actually working out the rest of the body, and then we're obviously
I always have generally had someone say to me a few years ago they were doing a booty builder, which is a new one. I was like,
you have to try and keep a straight face.
Well, not even that. It's not even that. I was like,
do you know what though? That weirdly,
more older.
That doesn't seem anywhere near as popular as it was.
True.
4 or 5 years ago. If you sort of whatever it's called, post boxing somebody, whatever it's called, pigeonholing somebody, if they were young female, early 20s female, mid 20s female, and they booked in, you could pretty much hang your hat and it's going to be some lower back pain because they've done all this glute work, and that's all they were bothered about. And it was almost like a conveyor belt of the same sort of stuff.
Yeah.
Whereas I can't remember the last time I saw somebody doing that, really.
I think, yeah, but I think that's maybe where the trends come. So we sort of talk about what's hot and what's not to basically try and talk about the pitfalls, aren't we? So, like, you know, we'll speak about hyrox, like, really good, but like anything, and there's more and more of these gyms as well, which not your stereotypical gym where you just go in and you're on your own. You do a push session, a pull session, a leg session. People are going in like they're more sort of like class-based and bigger bit, and then you gene each other up and you're doing these more high intensity sort of circuit stuff, sort of linking, which is basically what all these hyrox and all these things are. You're just a variation of a circuit, you know, without sort of just, I know a lot of people saying that, but just keep it simple. The point is that through that is we need to sort of recognise where the pitfalls are and where those errors are, and try and help educate people in, do that, but also make sure you're doing it right.
The one thing I found, not difficult, but a challenge overcoming the sort of new thing about these huge classes is if you've got someone, and we're talking previously, we talk about overtraining and deloading and stuff. If you've got someone, they're always the same, they want to train, and we never discourage anyone from training if we can avoid it. But if you've got someone that wants to go to a class, but you know in that class they're going to redline, it's going to be 100% come what may. It's really difficult to assess someone like, look, I need to go to that class, but I only want you 75% effort. I don't want you max effort, it's too much, it's going to overload. It's really difficult then for them to go into the class and then all back, because the social side is fantastic because there's all these people, but it's really difficult because then you've got external pressure from other people. Come on, you're sandbagging, you're doing this, you're doing that. There might be a genuine reason why that person is doing less effort, 75%, than managing an injury. It's either do 75% effort or don't go and go to a gym on your own and do it that way around. And I think it's our responsibility and the coach's responsibility to understand that sometimes, where they're too bothered about, I want maximum effort from you, come what may, and all you're doing is exacerbating an injury. Unless you categorically know what someone's dealing with, to then force somebody into redlining 100% in, I think it's ridiculous.
But the red line will drop on it, so they can do the max, but what the max for them, and that's it. And hopefully, and again, you know, dealing with gyms and stuff is, you know, there's a lot of good ones about who do tend to understand. And I think it's more, I would say it's more the psychosocial pressures they have. So how they're frustrated because I had someone say to the other week who just goes to one of these sort of gyms, and they were frustrated that they joined at a similar time to everyone else. They got to that level with everyone else, but everyone else has carried on. But it's like, yeah, but you've got sort of an issue with your tendon, so you're not going to be able to. You will get to that point, but it might just take another 12 months. And then you're also then, you know, like you maybe potentially worried how that then looks as well. So frustrated internally that you're not able to do as much, and then but also making sure that you don't want to be getting to a point where your sort of external pressures are affecting you basically. So yeah.
I think in terms of like what you were saying about the gyms, like we are lucky in that sense, like in Bolton and Leyland, that we've got good rapport with a lot of the gyms, like the different variations of gyms. You've got your boxing gyms, your hybrid gyms, your community gyms, and we've got good relationships and we know a lot of the trainers there, and a lot of the times they'll refer to us or we'll refer back because we understand how they work and they want the best for that client. They want them to keep exercising, keep healthy, keep moving, but we'll just say like these are sort of the no-goes and tweak this. So I think it's good in that sense that we work together to get that best end goal.
On a large percentage of the time, if someone's got their own PT, they generally recover a lot quicker.
Yeah.
Because you get that feedback between the two. We give them the rehab, explain to the PT, this is the reason why. They can implement that into their training session and everything goes well. You do unfortunately get the odd time where there's quite a conflicting PT that doesn't want to listen and wants to do their own. But again,
that's why one of my sayings is a good PT is worth the weight in gold, because we only have, we have an exercise science background and X, Y and Z, but realistically, practically, we all have a set amount of time with that person, unless you're going to come back loads of times, which is not really how we want to do things. So having a good PT, actually, I find if you've got a good working relationship with them, actually enhances what we're doing and builds on top. And it's, you know, again, another topic for the day, but it's why probably that sector needs to be regulated properly as well, because I find it frustrating for them that there's some really good PTs out there who are doing a really good job, but through lack of regulation, sometimes the charlatans bring them down, but that's just life, isn't it? But yeah, I agree. So it's again, that comes back to that when we're talking about that topic. If you've got the right, you know, when we're talking about hyrox particularly, you know, but just in general, these sort of activities that have become popular, it's social media, it's coaches, it's internal pressures, external pressures, it's understanding, isn't it, that do these activities, but make sure you've got the right balance.
I think as well, something that we all speak about between us is the sort of the popular events that are going on now, whether it be obviously hyrox, running, probably more so in those areas. I don't know if you'd probably seen it yourself in other areas, you know, a little bit in more the higher end, maybe triathlon and cycling, but the different variations of performance enhancing agents. And I think we're probably, I feel like I'm hearing more about that. we know ourselves in terms of people's results. There's only so much of an increase you can make in a certain time frame, and taking all those other factors we've spoken about, their own individual abilities and different things that they're juggling. How much can someone improve in a short time frame? And also aesthetically, we know how the body should look, and certain parts of the body look slightly differently because maybe they've got some sort of boost going on in the body. But also I think it's probably going on a little bit more around like people that are training together, and then it becomes more the norm. So socially, it's the norm for them. It's not like a cheat. It's, if anything, it's more like just a bit of a boost. But it's the concerning thing that we obviously know about is your short-term and your long-term side effects of that. So obviously, they're getting a short-term boost, but what's happening internally and physiologically because of that to the nervous system, to the psychology, and on a longer term, what's happening to the organs, the heart, the liver, the kidneys, and also just the tendons, like the thinning, the weakening, the body's performing up here, and it shouldn't be. Like, the safe zone might be here, and they're pushing that much further. So, something's got to compensate because of that.
So I saw this, where you touched about psychology there, sort of triggered a thought. I saw this, but the opposite way around. A couple of months ago, there was a lad that was coming in. Big lad, he was a big lad anyway, obviously started taking certain steroids. But he was running alongside his CrossFit and hyrox and all that stuff, started developing shin pain. And he openly admitted, I'm too heavy. It wasn't a conversation I had with him. He just came out and said, I'm too heavy. I know I'm too heavy. I banged on a load of weight far too quickly. He basically did my job for me. I didn't actually say anything. He came off him, started losing the weight. He was nowhere near as big. He was still in great shape, but he was nowhere near as big. And he was probably the only person I've ever come across who was content after coming off him. Like, he came off and he was like, I'm so glad I'm not on him. Miles better, my calves are great, my shins are great. I'm not as heavy, I'm not as bulky. I can do what I want to do now.
I'm not getting aggy with my girlfriend
Yeah,
anymore.
he was like the one person I've come across who didn't have this need or want to go back on him. Because you do get it. There's people that go on and they balloon. They look great. Do you know what I mean? They look good in a t-shirt and all that stuff. But when you come off and the rate in which they sort of deflate, there's then that need to get back on them. Do you know what I mean?
That's good, like psychology, isn't it? But I think it's like, you've got to be realistic. Like, dealing with bodybuilders in the past, it's kind of an open secret that. But again, that's a different challenge. You just got to be able to manage that. But I think I think for us, it's just understanding those risk factors, so we can then, either have that conversation with them. But like you say, particularly like the tendon issues, which is maybe what we're going to be dealing with most. We could maybe signpost them for other sort of more, when we're looking at liver or kidneys, we could maybe signpost them to get some checks and bloods and stuff and go through that route. But yeah, from an injury point of view, and we have to then recognise, well, we might be able to do so much because of that, the tendons are not as strong, so we could rehab it all day long, but if you're going to just cough and rip a tendon, then that's going to be hard.
And in terms of what you're saying about the tendinopathies, that's what we're clinically seeing. Obviously, just certain medications as well can obviously cause that as well, can't they? Just sort of weaken the tendon. So it's just important that we cover, obviously, that full subjective background, that we have a full picture of why they've got injuries and why it's led to that.
Just what you said there, Gus, about almost being open about the fact that you're taking something like that. Just sort of triggered a thought. A good number of years ago now, there was a chap who was coming in with he'd previously had an Achilles rupture, but then developed tendinopathy post-surgery. And it just wasn't settling. Whatever we did with it, whatever we deloaded it and managed it, it just wasn't settling down. But conveniently, every time I saw him, he was getting slightly bigger, slightly wider. I kept asking him, did he take anything? His medication change? That type. No, mate, no. Well, then was getting really aggy about this Achilles not settling down. And eventually I admitted that he was taking a course of Anavar. I was like, right, it makes a bit more sense now. We know what we're dealing with. And I think he was expecting a telling off. I think he was expecting me sort of going on him. I said, look, you can't change what you want to do. Do you know what I mean? I can advise you against it, but it's up to you what you do. But this tendon will not get any better until that stops. And he just went, well, my cycle finishes in 3 weeks. So that was his thing. He was like, I'm doing it anyway. I'll finish it in 3 weeks and then we'll go from there. And surprise, surprise, 3 weeks later, it slowly started to make progress. But I think that's the point really, is if it was open at day dot, you could have just sort of planned for it. You could have gone, right, well, we're not really going to get anywhere else other than this. Let's just try and manage it as best we can if you persist on taking Hanover. But I think it's a bit of a taboo thing, and some people are on it but don't want to admit it. Some people, like you said, with bodybuilding community, strongman, they're dead open about it. You sort of have to take it if you want to compete. But realistically, with certain injuries, you do have to be open about it and just say, look, I am on this. Will it affect my...
But it's also that naivety, I think, because it's like they don't think there's anything wrong with it because everybody in the WhatsApp group's doing it.
Yeah, it's the circle you surround yourself.
Yeah, that's education, isn't it? And I think, again, it's sort of like, if we sort of try and surmise this bit about like sort of what's hot at the moment, I think that's it, isn't it? Like, there's these running or hyrox, walking, football, you know, there's each activity, sport, whatever you want to call it, brings up its different challenges, and what we've got to do is adapt clinically in terms of being able to manage those injuries, but also adapt widely in terms of understanding those psychosocial aspects, don't we?
Obviously, we all answer this in our own different ways, but the two things realistically that we've all said that are the hottest topics at the minute are running and hyrox, aren't they? In terms of
we're just focused on that, but there's a few others as well.
There's lots. In sports, they're sort of what we've all touched on. Do you think, because it's a question a lot of people have asked me, do you think a runner makes a good hyroxer?
I think you need to decide what team you're in.
What, stick with one and stick with the other?
I'm not saying don't do the other. I think you can't be king of the castle of all the castles. You've got to choose what you want to be, what you want your focus to be.
Well, does a runner make a good hyrox?
Because the hyrox is basically eight 1K efforts with an exercise in between.
Yeah, no, I just think it's probably too individual. I think you know, if you've got it in you, you've got it in you. I mean, you know, I've known people in the past who are, you know, who have just got a little bit more just hybrid in their nature. Other people like are naturally very good runners, but you put a
like their anatomy is just more built for that.
But like, you know, like I said, I'm kind of thinking about myself where I've always been a bit of a sort of a jack of all trades. So I can run, I can play football, I can lift. I'm not like low down on any, but not high up on any either. So I think it's more due to your background. I think that it's not necessarily a runner. You know, if you're a runner who's always done a bit of weights, then that might give you an advantage. That's probably, but I think it's more in your natural physiological.
Yeah, and I think it is. It's like when I say that, I don't mean you can't be a runner and do certain events and you can't and then do hyrox. I'm just saying in terms of, I suppose, your load and your training, because otherwise your training plan is hyrox training, but then I also need to run 5-6 days a week or whatever, and it's like then you get your overtraining.
Yeah, I think from my point of view, and you each sort of stole my point. I think a runner, if you're a solid runner, it puts you at a great advantage of hyrox. If you're a good runner and you can bang at 8 1Ks at a serious pace, you're significantly at an advantage of someone who's not a great runner, because it's a large percentage of the event. So if you're a good runner but you're not the strongest in the world and you need to have a stop when you're doing the farmer's carry or you're taking your time in the sled push, I think you can combat that with the fact that you've just got pure speed. That being said, again, what you said about anatomically, if you've got someone who's so far on that end who's a runner, they don't weigh so much, there's not much weight behind them, there's not much muscle mass up top, they will struggle with farmer's carry, walking lunges, sled push, that type. They'll get through the row and they'll get through the ski through pure cardiovascular. But again, just what you said there, Maz, you see it loads with people training for hyrox, which is this really short-term, intense hour and a half of exercise, whilst trying to train for a marathon at the same time. And they always wonder why they get injured, because the plethors apart. You know, the training schedule for a marathon and the training schedule for a hyrox, they're just so different. I understand hybrid athletes, I understand the sort of concept of it and why people want to do everything. I do get it, but you're not gonna, unless you're absolutely tip top of your game, you're not gonna perform ultimately at your peak at the marathon and the hyrox, because the two just don't mix together.
Keep PB in, because when you hit that goal, you don't. You know, where'd you go then? Because they keep wanting more and more and better and better. If
you're training for hyrox and a 10K, fantastic, you're probably nailing it. If you're training for hyrox and 5K, super, you probably get away with it for half. But marathon into ultras, that type of thing, they're so far apart from each other. I just think you're asking for overload, tendinopathy, stress fractures, shin splints, all sorts of stuff.
I was just going to change the subject now.
Well, go on.
I was just going to...
This is interesting.
talk about more one of the hot areas of women's health. Obviously, between us all, we see male, female populations, and we've got a good rapport with one another, but we've kind of built up a good reputation over time that we get those recommendations from people and they feel comfortable speaking to us all about different sort of female conditions going on. Obviously, if they're going through certain body and life changes, so they might be pregnant, they might be postpartum, going into your sort of midlife, your perimenopause, your menopause. I think over the past maybe 5+ years, I think we've all seen like menopause is being spoken more about, and it wasn't maybe previously so much so, which is a shame for previous generations. But I feel like we're seeing people with related conditions, but also we're getting that chance to chat to those populations and see the other factors that we might be able to help with, like if they're struggling a lot with anxiety or mood or deficient in certain things, it might be something we discuss with them and recommend they speak to the GP about or nutritional advisor. But do you guys feel that you're seeing more of that or same amount?
Yeah, I think, again, I think it comes more from the recommendation standpoint. I think it's a case of we've probably helped somebody, whether it's any of us, where we've probably helped somebody through the certain situation, who's then recommended her to a friend. It's funny really with menopause in one respect. I always find it slightly, not nervy, but slightly, I'm cautious when I mention it, when someone's not mentioned it to me. Do you know, the whole, could you potentially be going through the, are you of an age where you could potentially go through the menopause? You know, when you're picking up on certain situations. Yeah, there's one in particular I remember. It was one of the first times I had to do it, which is why I remembered it. She'd come in with basically a bilateral trochanteric burst of pain, and she was of that age where you're thinking this is more actual menopause symptoms rather than just a standard bursitis. Yeah. And I asked the question so nervously. Do you know, like, you think you could potentially be going through the menopause? And it sort of triggered. I just went, what's the end? And I thought about that. And that then triggered on going to the GP, HRT, whatever else it was after that. But I was so edgy, and I don't know if it's just coming from a young lad to a woman. You know, I don't know if it was that situation. But again, over the years, you develop the ability to do that. And I think people are often in that situation. I think they're happier that someone spoke about it. Yeah. You know, and they're happy that someone's listening to them as well. I think that a lot of them struggle with having very little help from the GP or the NHS. They're just given HRT and off you go on your way. So what was then previously a really nervy conversation, for me, I actually quite enjoy it in a weird sort of way because they're dead grateful for your help. But yeah, to answer your question, I've probably seen more recently, but I do think it comes more from a recommendation standpoint.
And I think that is probably a society of people just sort of marketing more and chatting more about menopause. And obviously you two, you're both married, you've got strong female environments, obviously family as well, and clients, you understand it because you're chatting to it more. So although it's not something that would be affecting you in terms of the perimenopause and the menopause, you understand it, you understand the science behind it, how it affects your body. I mean, I've obviously been through 2 pregnancies myself. My body changed completely in both of them, like during and post. I don't think in the perimenopause, but I like to call it, you know, it's probably the peri because naturally my age and body, and I just know that my hormones personally have been completely different after second child than first child. And it might be that, like, obviously be quite open with it about clients because we're just normal people at the end of the day, but we'll be chatting to it and I can then maybe really relate because of a symptom with someone who might be, you know, in the 50s, and it's nice to have that sort of rapport with them and let them know, you know, it is normal. But what's not normal is if you're not struggling to cope with that, or it's having another effect on other things in your life. And that might be then when we suggest certain other professionals to speak with as well.
Yeah, I think just going back to what your question was, like, yeah, there's been a big drive to talk about menopause and get out in the open. And there's even sports teams, like, I mean, so my football team, Huddersfield Town, and they do, I'm pretty sure they won an award for their menopause workplace, the stuff they do. I personally, a running club that I've kind of been linked with for 13, 14 years, maybe a bit longer, it's just a female only one, and there's people in that, and they've done a lot of talk around menopause, and it's a bit like cancer, isn't it? You know, some people get cancer, but at some point everyone's been affected by cancer. You know, and it's the same with menopause. Obviously, classically women will get menopause, but you know, men will be affected in different ways, and it's important. It's a bit odd for me. I mean, we're in this bubble, so we see a lot of things, and like for me, we have a skew with perception of the society sometimes, because we deal with, for me, I've dealt with women all my life, and we see, so when we see these things, it's easy, but you realise actually a lot of society, even though it's been talked about more, there's still a big chunk of it, it's still a bit of a either taboo or unknown. Yeah. But like I said, I think experience is the key, isn't it? I mean, I think I would just say, like, I know I might be sort of 37 male, but actually I've seen this all before. And I've seen it all before and done all that stuff. And then it was quite like with my masters a few years ago, that was also a benefit where a lot around women's health, bone health. I think maybe we could do a bit more on women's health. I think I'd do a full-on deep dive into it, because I'd also want to talk about Red S as well, which obviously is the other end of the spectrum. But so maybe that might be, but we could maybe talk about that next.
Yeah, absolutely. And just touching, obviously, women's health, men's health is equally as important as well. And I'm not a male, but I've got a husband, I've got a son, I've got two very important males in my life here. So we want to be able to understand what the individuals are going through and them hormone changes throughout their life.
It goes back to that hot topic, you've got a runner or a hyrox trainer or a knitter or a walker or a walking football person, but then you've got like a man in the 50s, a man in the 20s, a woman in the 40s or 50s, a woman in the late teens. You've got these hot topics create different challenges, and just trying to, the point I was talking about the hot topics is just to pick a few, and hopefully people understand how we approach it, really.
Yeah.
Bro, so we'll wrap up there, and we'll be back next time with some more valued information.